Good morning, Cynthia. Thank you so much for joining us for this episode of Thrive With Us. I'm really excited to speak with you today about an area I know you're really passionate about, relationships. We're going to be talking about it from an attachment lens, since so many people these days seem to be interested in what attachment is, what it means, how it develops, and how it impacts us. So I'm excited to pick your brain and hear about what's been happening for you in the clinic later in this episode. Before we begin, I'll just take a minute to introduce you to our audience. So this is Cynthia Ghosn. She is a DHA licensed clinician at Thrive Wellbeing Center, a Psy.D candidate from Meridian University in the USA, and you've been practicing with us now for just over a year, primarily supporting people that are 18 and above at Thrive. I know you have a number of areas of expertise, but one of the things that you're most interested in is relationships, as well as anxiety and depression.
Yeah, relationships through the attachment lens. I would say anxiety, yes, and depression, also burnout. I think we experience that quite a lot in Dubai.
Yes.
It's something that we face, almost every day in the clinic as well with different clients as well.
Thank you for your time. So why don't we have a quick discussion about what attachment is? I think it's one of those words that's being thrown around a lot these days. Sometimes people really understand what it is from a scientific perspective. Sometimes there's a little bit of confusion as to what it means. So what is attachment in general, and what does healthy versus unhealthy attachment look like?
Okay, and attachment styles, let's just begin with that.
Okay.
With attachment styles, we say they evolved out of survival. Whatever attachment style that we have, whether it's healthy or unhealthy or secure or insecure, they tend to evolve out of the security of the environment that we have and out of the survival aspect to it. Now, having said that, our primary caregivers or our parents are the first social interaction that we ever come across. And so they kind of pave the way towards us learning, how we perceive people around us, how we seek our needs, how we kind of respond, or how we kind of, let's say, react to people's emotions, people's behavior, and also how we see people as being maybe safe or not safe. So they really form a blueprint for us from such an early age. And through that, we start to see that with parents or caregivers that are emotionally attuned to the child's needs, the children of those parents, they tend to have much more secure attachment because they learn that they can ask for their needs. They learn that they can express their needs, and they learn that people around them are quite safe and reliable as well. And so with the other end of the spectrum, where children have been raised around, let's say, parents or caregivers that were not as emotionally attuned, they tend to struggle quite a lot with that. And they tend to have trouble with emotionally, expressing themselves, letting other people know what they're going through. So they seem much more maybe closed off. And we will see how different attachment style actually gets manifested with different people. So yeah, that's
okay.
Really
awesome. Thank you so much. That was really, really helpful. And from what I can understand, basically we can divide into two different categories. There's more of the healthy, secure attachment, and there's more of the unhealthy, insecure attachment. And there are some styles within that I know that we can discuss.
Yes.
One of the terms that you used a couple of different times was emotionally attuned. So can you explain how that shows up? So how can a parent or a primary caregiver demonstrate or convey that emotional attunement to young children as well as older ones?
Okay, for sure. So with emotional attunement, it really is about being, again, I will use the word attuned, but it's about being really present with the child's needs and knowing what the child wants, and not necessarily mind reading. I don't really necessarily mean that, but also picking up on the cues, allowing and giving that space for the child to ask for their needs and really seek out that unmet need that they would have. So it's about being present with the child, being mindful with the child, giving them space to actually take risks, because the more they are secure with you, the more they're willing to actually go outside in the world and take risks. So emotionally attuned is about meeting the needs of the child, both implicit and explicit needs as well, and creating that safe environment, let's say, for them and safety for them.
Okay. So what I'm hearing from you is really being plugged in to what your child needs and being aware that what they might be presenting with on the surface might not necessarily be what they need. And so an example that sort of comes to mind is when you have, let's say, a 2 to a 5-year-old who might be behaving in a way that is not really consistent with how they tend to behave, maybe having a little bit of a tantrum, being very, very sensitive about something. An emotionally attuned parent, if I understand correctly, will be able to recognize that, oh yeah, they haven't eaten, they skipped a nap, they're upset because something else preceded this interaction. And so what they really need is this, even if it's showing up in this other way.
Exactly. So as you were saying, it's quite being, I would say, really mindful and really present to notice the differences that the child is even presenting with, and not to just, let's say, ignore it or neglect it just because, oh, it's another, let's say, an off day or so. So being really present with the child is quite important.
Okay, so being present and then trying to meet their needs. And then you mentioned another point that I think is really important and interesting, and that's about being the safe space. So how can we become the safe space for our children? And what does that enable them to do in childhood and beyond?
Okay, I'm glad that you asked that, because even with research, what they found out was that whenever you are, as we said, emotionally attuned to the child and you're creating that safe space for them, they generally tend to thrive. And we mean like thriving in academically, even thriving in social interaction, thriving in emotional regulation. So a lot of research has been done that shows when a child is brought up in a safe environment and having that secure attachment, it's as though it gives them this like boost of courage and bravery to really experience the world around them and to really take risks. And that's not something we see with, let's say, insecure attachment. There's a lot of fear there, and there's a lot of, let's say, reliance on others in that way, that kind of reassurance that is needed. But with secure attachment children, you see them to be quite open to the world.
Okay.
They see the world in a different lens, in a much more positive lens. And that's purely because of the parents. The parents have given them that kind of blueprint of, you can rely on me, and I am here for you, and I am here to support you. So they really thrive in multiple areas of life, and research has also shown that.
Okay, so what I'm hearing from you is research has very strongly established that forming that secure attachment with your child helps equip them with the skills that they need to engage with the world, to explore different things. I think when some people hear the word risk, it can carry a little bit of a negative connotation, but it's not necessarily a negative thing. We also don't want children to be only comfortable in their zone and in their box, because otherwise they're not going to be able to meet their potential and develop new skills. So a place where they can safely take risks, knowing that if they are going to fall or things are not going to pan out the way they anticipated, they have someone to catch them. They have that safety net.
Exactly, to rely. And also another point would be that when a child has that kind of secure attachment, it becomes much easier for them and much more fluid for them to develop their own self-identity, their own sense of self, their own self-construct, because they have had people in their life to show them how to do that, to also help them look within their emotions. You know, when you have a parent that's emotionally attuned to the child, they tend to be very curious about what the child's emotions are. You know, let's say they're getting triggered, whether they're upset, as you were talking about, or even when they're happy. And they tend to mirror that to the child. They tend to reflect it. And that can go such a long way in their own emotional development, their own emotional regulation system, and their sense of self, how they start, like how, let's say, they start to regulate themselves and assure themselves as well.
So that makes a lot of sense. So having an emotionally attuned parent helps you identify your own emotions, which is really important for that regulation, as you were saying. But also when we understand ourselves and our emotions better, we start to develop a more coherent identity, which is a major part of our adolescence and emerging adulthood. So it sounds like secure attachment is really helpful across the board. And I'm guessing then the inverse is true, that insecure attachment, having parents or caregivers that are not as attuned can be problematic for those different areas. And you touched on a couple of things, people being more cautious, being more concerned that if something is going to go wrong, that no one will be able to help them. And so they don't try new things, but then also becoming very reliant on other people. How are you seeing insecure attachments showing up in your work with clients?
With that, there is 3 different types that show up in terms of our clients or even just in general. So we have insecure attachment of anxious attachment style. we have avoidant attachment style, and we also have disorganized attachment style.
Okay.
And each one of those attachment styles, they show up quite differently across the board.
Okay.
With the only thing is with disorganized, it's a mix of both. It's a mix of the anxious and it's a mix of the avoidant.
Okay.
So with the anxious style, what we have seen or what I see in the clinic, and I do want to preface by saying, what are the early childhood experiences that an individual goes through before even reaching that point?
Okay.
And so with clients that are anxious and they have that kind of like anxious attachment style, you would see that their history or their childhood would center around much more of inconsistent parenting. And what I mean by that is a parent one day is emotionally attuned, another day isn't. And I know that sometimes as parents, let's say we have one day off, and I don't mean that. I mean consistently inconsistent, if that makes sense. So they are, one day they're there, another they're not. So what the child learns at that point is that the environment is quite unpredictable and it's quite confusing as well. So they develop that kind of hypervigilance and that kind of hyper-awareness to any kind of signs or threatening cues in the environment.
Okay.
So the child's system is constantly anxious, constantly on the go in a sense for survival. And so what that shows up in the clinic, or let's say with clients, is you will hear things, one of the hallmark of anxious attachment style is that fear of abandonment, or that really deep-rooted also fear of rejection. And if you go back in time, that makes perfect sense, because when parent walks out or when one day they're good, another day, I don't know if the parent is going to be good. So that kind of fear of abandonment gets, triggered because of those past experiences. So it makes the client, when the client walk in and they share those kind of experiences, you can see the hypervigilance, you can see the hyper-awareness with all the people in their life. And I do want to stress by saying with attachment, it doesn't necessarily mean just romantic or intimate. We are talking about interpersonal relationships, whether it's friendships, whether it's intimate, whether it's even family dynamic. So it encompasses all kind of interpersonal relationships. And so what tends to happen with the anxious attachment style individuals, they tend to have problems with trusting other people. They tend to have problems with communicating their needs to other people, communicating their emotions. They tend to also have difficulty with also low self-esteem and low self-worth. And again, looking back at it, because of the inconsistencies of the parents, they would have thoughts of like, but am I good enough? But am I worthy enough? Am I lovable enough? And that's also due to not only that kind of triggers the self-esteem and the self-worth, but it also triggers another behavior that comes across with clients, which is the constant reassurance that they need, that constant validation that they need. And this isn't to say, I do want to preface, this isn't to say that we wouldn't need that on a normal day-to-day life. Validation is quite important, reassurance is quite important. But in cases of anxious attachment individuals, it becomes quite maladaptive at times and quite debilitating. So this is how it is seen to affect their own relationships and their own intimate relationships more specifically. And even in terms of conflicts, whenever they are, let's say in an intimate relationship or even in general, the conflicts that tend to happen or the dynamic can be a bit too tense, can be because of that anxiety. So there is emotional heightency that happens in that moment. And because of their inability to regulate their emotion, you can see impulsive behaviors come out. You can see anger, lashing out. So a lot of these things, again, if you look back in time, that's what a child does too, throwing tantrums, lashing out, because they're craving that attention and that attention is not being given to them. So that's really within the anxious style. Shall we go through the avoidant?
Yeah, so we can. I just want to comment on a couple of things that you shared when it comes to the anxious. So as you were describing the child that has that anxious attachment, what I was thinking of is something that people are almost encouraged to do, or were encouraged historically to do. And that is how we say goodbye to children. So I'm picturing a young child and a mother as the primary caregiver in most cases, going back to work and people knowing or suspecting or worrying that the child is going to have a negative response to that. And so to protect their feelings, what will happen sometimes is people will sneak out of the house. And in that moment, as you were describing this question, this idea of consistently inconsistent, I was picturing this child being like, wait a second, 1 minute mommy's here and the next minute mommy's not. So whenever she's out of my eye line, I'm going to be worried that mommy is going to disappear. And so this is just one way I think that it can show up. But I think really the important point here is that we need to be very consistent presence in their lives. We need to be mindful. We need to be attuned, and we need to do all of those things that you shared just a few moments ago. And of course, no one is ever going to be perfect. But if the child can't predict how we're going to behave, of course they're going to be worried. Of course they're going to question their worth. You were saying this idea of self-worth, not being good enough. These are major core beliefs that we see in CBT that people struggle with, and they impact us on a day-to-day level. So I can imagine, and I see in my own clinical work with couples, that they get activated really quickly, that you're responding to me in this way because you don't love me, you're not recognizing my needs, I'm not important enough to you, and then it kickstarts a whole thing, especially, I think, if the other partner is from the avoidant subtype.
Exactly.
So why don't you walk us through what that subtype looks like?
With the avoidant attachment style, their early childhood experience had consistent parenting, but consistent in terms of emotional neglect. So they didn't experience the inconsistency or the unpredictableness, but they did experience quite a consistent amount of time during their childhood where they were constantly emotionally neglected, where the parents are emotionally distant from them. And so at that stage, what the child will also learn that I cannot rely on others. I cannot depend on others, because if my own parents weren't really present, who else will be in that way? So what that tends to show up in adult relationships as well. Again, there is that difficulty in trusting others. There is difficulty in relying on others. And first and foremost, there's also that repression of emotion. They don't feel comfortable. They don't have the ability to express their emotion. And again, looking back at their childhood, they never learned how to. Nobody taught them how to look within, mirror their emotion. They didn't go through that experience. And so due to that, they would have difficulties as well communicating with other people, communicating their needs, communicating what they would want. And so due to all of that, they tend to be very emotionally distant as well. And they tend to not seek out relationship. And closeness for them is actually quite threatening. They feel that the moment they get close to someone, maybe you notice it, and maybe some of the people in your life, the moment they get close to someone, they quickly push them away. And that's because closeness for them is not safety. Closeness for them is a source of threat. And so they value independence over anything. They value independence over closeness with other people, over bonding with other people. And they even, look at emotional intimacy as being something that they don't quite need. And you would hear people say things along the lines of like, yeah, I don't need to be in a relationship. Like, I'm really fine being single. And generally, at a very much face value, they are quite fine with being, by themselves. But that's also because they tend to push people away. Because again, intimacy is quite threatening to them. So that's really how it impacts, as you were saying, if you get an avoidant attachment style with an anxious attachment style as being in a couple, that's quite difficult. That's because one is seeking proximity and the other is like, no, this is too threatening. And
needs the distance.
Exactly.
Yes. No, that's really helpful and informative. And as you were describing the avoidant subtype, I was picturing again a child needing something from their parent, whether it is attention, reassurance, their favorite meal, just anything, and recognizing over time that doesn't really matter what I want or what I need, right? I'm not going to get it. So instead of, putting myself in that position and feeling hurt and all of the normal so-called negative emotions that can come up in response to that, I'm going to create that distance and then nobody can let me down. And it sounds like that's what ends up happening in adulthood as well, that it's like, I'm going to be very independent because I can rely on myself and I'm all I've got. I've heard people say things along those lines as a way to create that safety.
Exactly. And they would even use words like, for example, I'm quite self-sufficient. I don't really need anyone else, which in reality they quite are, but not to the extent that they think they are as well. And even if they do end up being in relationships, what you would see in terms of the conflict dynamic would be that they would either be very silent, they would either stonewall, they would either just distance themselves, zone out, just complete shutdown in that way. Or they would not really stand up for what they really need and they would just let things slide. And so that can create quite a lot of resentment in the relationship because they are being, let's say, not quite silenced, but they choose that route in order to de-escalate that conflict.
Yes, and it can come across as being disengaged. And if you're partnered up with somebody who is more anxious, then they will see that as activating their fear of rejection and abandonment that you described before.
Exactly.
it can be quite a tricky dynamic. And at the same time, it's a very, very common dynamic for us to see out in the world, but also in the clinic. And one of the things that I've seen in my work is the anxious partner often struggles to recognize that their partner has feelings and does care. You use the word stonewall. From the outside, this person looks completely disinterested, completely disengaged, completely unfussed. But on the inside, there's so much going on. They're just demonstrating it and responding to it in a different way.
Yeah, exactly. And even research was showing that in terms of with the anxious attachment style, whenever there's conflict, their heart rate would increase, even blood pressure would increase. And then with the avoidant, even though, as you said, they look completely unfazed by it, their physiological responses are the same as the anxious attachment. It's just, it's not shown. It's not being expressed as well, again, out of safety for their own, kind of space as well. So it is quite true.
Okay. So now we know about the anxious style and we know about the avoidant style. And you said that the disorganized is a little bit of both.
Yes.
Do we see that people tend to be more one than the other, or is it kind of 50-50, show up sometimes anxiously, sometimes avoidantly?
I would say it purely depends on the situation that they're in. Okay. What is getting triggered at that moment? I wouldn't necessarily say 50-50.
Okay.
Yeah, but it does depend on the situation. And with the disorganized attachment style, they came from a childhood with severe childhood trauma, childhood abuse, childhood neglect even. And that created in a way where the parent, who is once that safety figure, is also now a source of fear. So even looking back to stories that we have heard, or even to let's say clients that we have seen, if their childhood had any form of abuse, whether it's physical, verbal, sexual, emotional, that same, let's say, parental figure tends to be someone that they want to seek that proximity to. They want to, let's say, amend whatever bridges that have been burned. But at the same time, they fear. There's a lot of fear. So with disorganized attachment, the main element to it is fear. And that's kind of what makes it different from the anxious and from the avoidant. And what makes them also different is they want that relationship, they seek that intimacy, yet they can't go forward with it. They fear a lot of hurt that might be caused. So there's a lot of, again, that push. And you might think, okay, that sounds quite a lot like avoidance in that way. The difference is with avoidance, they don't really seek that proximity. Yes. And even if it happens, they don't want to be in that relationship. There's a lot of closeness towards that. But with disorganized, they seek it, they want it, yet they can't.
It seems very on and off.
Yes, exactly.
I want it, but I'm scared of it.
Yes.
But I really need it because we are social creatures at the end of the day. But I don't want to put myself again in a position where I'm going to be harmed. And as you were talking, one of the things that came to my mind and a question I'd like to ask you, in adult relationships, intimate relationships specifically, do people with a disorganized style have a tendency to look at their partner as amazing one day and then really terrible or bad or scary another day? Do they tend to kind of put them on a pedestal at some occasions and then at other times just either cower away in fear or look down on them for another reason?
Yeah, that can definitely happen. And it's because of that mix that they have where one day my partner is amazing, they're not giving me any reason to, let's say, distrust them, or they're not giving me any reason to, as simple as break off the relationship. But at other times, they would only focus. It's that self-fulfilling prophecy that they start to manifest. They would look for reasons. They would look for any kind of threatening cues, any kind of signs where it could be as simple as, well, he canceled on me, or, oh, he's not really answering me for the past, I don't know how many hours. And they would take that and they would run with it in a way.
Okay.
So they do have that mix of both. And that's where they seek that proximity and they value the person, but at the same time, it's way too scary. So they push it away as well.
I wonder what it's like to be in a relationship with someone who is disorganized, because if you have someone who tends to be more anxious or more avoidant, you can predict in a way what you're going to get. I know that this person needs reassurance. I know that this person is going to want to solve that problem the minute that it happens, or I know that he or she needs to cool off and needs a little bit of space to process. But with disorganized,
exactly,
that can be quite unsettling. And I imagine if paired with anxious in particular, where you do have that consistent inconsistency, it can be very triggering for both.
It can be. And with like, even as you were saying this, if you look back at their childhood, that's exactly what was happening. It's the mixed signals. It's then on and off. It's like, I don't know what to believe today. If, let's say, my parent is going to walk in, are they going to be loving or are they going to hurt me? So it's the same thing that's getting mirrored in adult relationship, where they themselves start to have contradictory behavior, but that's all they knew. That's all they got taught in that way. It is quite difficult.
And I think this is an important point that sometimes people don't recognize. It's that we as humans tend to be comfortable with what is familiar, even if what is familiar is deeply uncomfortable. And that's why we often see so much replication of patterns from our family of origin. Not to say that we can't break cycles, and we'll definitely talk about how we can do that a little bit later, but we do what we know, and what we know is what we experience. So going with the attachment styles, now we know there's secure, there's anxious, there's avoidant, and there's disorganized. Remind me about the general proportion. I believe the vast majority of people would be categorized, if we had to categorize, under secure, correct?
Yeah. And the insecure, I would say sometimes it's also gender related as well, in the sense of, more prevalence of having anxious attachment style with females. And there is more in terms of avoidance and in terms of males. The disorganized, it's a mix as well of both. But even with having that, like, I'm glad that you said that the majority maybe will be having the secure attachment, which means that with anxious or avoidant, there's a chance to have a partner that's secure and that will mirror that secure attachment. And we will get to that into a bit later. But this is where it's like, in a way, you're getting reparented. In a way, you're learning again, what does a secure attachment look like? And so I am glad that, let's say, the majority would be secure and the rest maybe would be the much more insecure attachment that we meet.
I don't know if it's been the same for you, but I've noticed that in recent years, because people are interested in psychological concepts, because attachment is such a key, important, robust theory, a lot of people come to the clinic saying, he's avoidant, I'm anxious, and so on and so forth. And sometimes they're right. And other times they're kind of using a big umbrella term to typologize themselves in a way that might not be totally accurate. So they might have anxious tendencies rather than be anxiously attached. And so I think it's important for people to be aware about the labeling and what can happen when we label. You said self-fulfilling prophecy. If I'm in a relationship with someone and I decided that they are avoidant, I'm going to see that avoidance in ambiguous situations as well as when it actually shows up. And if I'm anxious, it's going to trigger me. And then I'm probably going to come across as anxious to him. And then we're going to end up in this cycle that we were describing before. So I think it's a very helpful framework, but sometimes it can be a little reductionistic.
Yes.
So we need to be sort of mindful of that. Okay. So we talked a little bit about what the styles are and how it impacts on our relationships. You mentioned a phrase that I've also heard a lot lately, which is reparenting. It sounds like this is one of the key ways that we can heal or move forward from having an insecure attachment style. Can you talk a little bit about what people can do if they recognize that they either fall in one of those categories, or maybe they know that they're a little more anxious or avoidant or disorganized than they might like?
For sure. I think I can confidently say that with whatever issue comes in through our clinic, we always, the first and foremost skill that we work with clients is awareness. So this is the first step. We need to build a lot of awareness into what is even your attachment style. You know, like right now, as we were talking, what resonated with you? But at the same time, again, always seek professional help, even for that, because as you were saying, we don't want to just diagnose. But having said that, knowing your attachment style can open quite a lot of doors into understanding your own triggers, into understanding your own emotional regulation system as well. Because if you're anxiously attached, your emotional regulation system would be more heightened and more hypervigilant quite a lot of the time. If you're more avoidant, it tends to be more shut down or shut off or numbness. And disorganized is, again, that mix of both. So gaining the awareness into what attachment style am I presenting with, even traits of it, and that's still fine. And getting to know what are the triggers, and triggers could be thoughts, could be emotions, could be situations, could be even people, like other people, how we might perceive them to be. And once we build that awareness around that, we can definitely start working towards, then it becomes a bit more, let's say, organized in a sense of, then we work through emotional regulation, let's say, skills. Then we work through communication skills. Then we work through, let's say, setting healthy boundaries.
Okay.
And I do want to also specify by saying, I think it's important for us to know that, yeah, we are talking about insecure attachment, but what does secure attachment look like? Because with insecure attachments, people who have grown up in such an environment, they don't necessarily know what a secure attachment look like because they haven't been exposed to that.
Yes.
And so it's important for us to also gain that knowledge and that insight into, well, what does a secure attachment even look like? What should I look for in a relationship? And I feel right now with the whole internet idea of, like, let's say, whether it's Instagram, whether it's TikTok, there's so many videos that tell you, oh, you shouldn't, let's say, compromise on this, or you shouldn't, let's say, get triggered by this. But at the end of the day, it's about introspection and self-reflection to your own values and belief to know where you draw the line. But also it's about knowing, what does a secure attachment look like? It's about open communication with the other. It's about being vulnerable with the other. And like, even as Brene Brown says, like, it takes courage to be vulnerable. So I completely understand it's not something that would come very easy or very naturally to people. It's quite challenging to do, but it's about also being able to express your needs, knowing that you can reach out to others, and reaching out even to others that seem reliable and supportive to you. It's about also listening, empathizing, understanding where the other person is coming from, taking a step back, not jumping to conclusion. So secure attachment embodies quite a lot of things where we might not be, let's say, aware of, I would say. It embodies also the healthy boundaries that we would want to place. And I would specify by saying healthy boundaries in terms of your own emotional safety. Because with anxious attachment styles, we cannot just, let's say, throw that person right in the middle of a lake and tell them, okay, like, now you have to be secure. No, they're going to get triggered by many different instances. Like, for example, some clients come in and say, when, let's say, they don't text me back for hours, like, I feel really anxious. Like, my mind just goes through the worst case scenario of, like, we're going to break up or so. Knowing that you have that trigger can start to place those boundaries of telling the person that you're with, you know what, whenever, let's say, you don't reply to me for hours, I get really anxious. It really triggers that side of myself, let's say. So I would really appreciate it if you can let me know that you're not going to answer me, let's say, for the next few hours, or even when you come back, the way you respond to me as well. So in this way, you are compromising, you're creating that healthy boundary that is still safe to your own emotional system. The other aspects as well that we can definitely practice is mindfulness. And what I mean by that, to be not only mindful of your thoughts, your triggers, your emotions, but also being able to ground yourself whenever those emotional, let's say, triggers happen, that heightency happen. Grounding yourself with either body scans or either, let's say, even breathing techniques or even counting before responding. But again, all of that can only work once that awareness is there and once the insight into but what is really happening on the inside.
I think that's
present.
really, really helpful. You've given a great overview of so many different things and kind of the sequential and overlapping nature of it. I think in general, when it comes to therapy, there's gaining insight and awareness. There's also the practical strategies, and we can use both of those techniques and goals to make productive changes for people that are trying to heal from an insecure attachment. Awareness, I think, is very key for all of the reasons that you mentioned. And people listening might think, oh, well, I am aware. I know I'm anxious, or I know I'm avoidant. And that's fair. You know yourself better than anyone else could. You're the expert in your own life. But what I've always found is that people don't always pick up on all the ways that it shows up. You were giving an excellent example of something very common. We're living in a world and in a city that's super fast paced. There's so much going on. And even if your partner is top of mind, you might not be able to express that. You might not be able to engage. And so if you are noticing that every time there is a delay, it calls into question your value, the relationship's value, and that you continue to feel activated if the person doesn't greet you in a very, very welcoming, loving, reassuring way, This is a small example of that.
Exactly.
And as you were saying, once you recognize the tiny ways that it shows up, even if the impact is not tiny,
Yeah.
but the tiny ways that it shows up, then you can take those steps to saying to the other.
Exactly.
But what happens, let's say, continuing with this example, it makes me feel super anxious when you disappear and you don't answer my calls and I don't hear from you for hours. I need you to keep me plugged in. Now, imagine we have a securely attached person. I would imagine they'd be able to kind of tune in to that and do it to the best of their ability most of the time. What if you have an avoidant person who all of a sudden now is like, whoa, I just didn't answer the phone for 2 hours. Like, what is this all about? How does that work?
I'm sure you also see that quite a lot within your practice too. And it gets quite tricky and quite, let's say, anxiety provoking, I would say, in the room as well, whenever these examples being brought up. And in that case, again, I would say it takes two to tango.
It does.
So when the avoidant as well can even be able to gain that awareness into their own triggers, that's a trigger, right? That's a trigger of like, you're also crossing my space. They value that independence and they value that distance that they create for themselves. So that is a threat to them. Being able to even just name it as such, being able to even name that trigger, they will reach a point of compromise because at that moment, you're both being very vulnerable. At that moment, you're placing the cards out in the open, being very transparent. This is what triggers me, and this is what triggers me too. So finding maybe that compromise between them of, you know what, yeah, I didn't answer you, but even explaining your perspective, why you didn't answer, you know, what does that even mean to you? So in therapy, I feel we slow down the process because we really ask questions, but what happened at that moment? What did that mean to you? What did that look like to you? And those are questions that they're not going to be asked when you're in the middle of a fight.
Definitely not.
So whenever in therapy, you have that like muscle of introspection being built, use that to your advantage so that you both know the triggers that come up and then you can both compromise. But I would say that it is quite tricky because you are dealing with opposite ends of the spectrum. You're dealing with someone who's quite anxious and emotionally reactive, and you're dealing with someone who's very much closed off. But it all takes a bit of awareness, I would say, and also the proactiveness, like that you do want to change for the partner and that you do want to connect with them, let's say. But it does take a lot of work, I would say.
It does, and it will never be perfect. Yeah. That dynamic will always show up despite the strategies and the skills that you build. It will just be less frequent, less intense, and be able to work your way through it. Exactly. As you were sharing, one of the things that came to mind is some of the couples that I see with this dynamic, they get flooded. One of them kind of pursues, the other one withdraws.
Exactly.
And in that moment, like you were mentioning, we can't look at things in a rational way and communicate and receive that communication effectively. So often, according to the Gottmans, which is the main framework that I use in my couples work, the idea is to take a break and a timeout. Now, that can be super provoking for the anxious person. And so what we found is that if you tell the anxious person, we're going to take a break to cool off for like a couple hours, you go do you, I'll go do me, but you can rely on the fact that in 2 hours, we're going to come back and try to hash this out. That helps because it's not this big, that's open-ended thing. So this is one of the techniques that I've seen can be helpful, although, you know, it can definitely be difficult to implement, especially when one or both partners are really triggered. Okay. So we talked about some of the strategies, and you were saying as well earlier that if you have a securely attached partner, they can help. They can be a model for that. Have you experienced or seen, or what do you think it's like for the securely attached person who's like, hey, I'm not as easily triggered. I know that you are anxious, avoidant, disorganized, and it's not your fault. It's kind of what happened. And now I kind of have to, you know, meet you where you're at most of the time. And that can tip the balance. And we know reciprocity or equilibrium to an extent is important for relationship satisfaction. So how does that work?
That can be quite draining. Like, as you're saying this, what came to my mind is when we say, if you're in a relationship with someone who is battling depression, like mood disorders are contagious and they can also drain you the same way they're draining your partner. So within that same context with relationships, a securely attached person, may at times be pushed to the limit of like, but I'm always the one putting in effort. I'm always the one compromising. So that can be in itself quite draining to the relationship. And it can even, lead to the end of that relationship too. So again, it's always, it takes two to tango. And in the meaning that with an anxious attachment style, with the securely attached style, from the get-go, knowing kind of that boundaries to place, knowing what triggers you, again, it goes back to that self-awareness, that you can be able to communicate with a securely attached individual. Because the difference here is that is someone who will be attuned to you, that is someone who will be able to empathize, to understand, and also always give you that benefit of the doubt.
Yes.
And you can always rely on them. And you need that benefit of the doubt in the start of that relationship because of your own triggers as well. And as you walk through that relationship bit by bit, building that kind of security around you, that's when, as you said, the anxiety tendency will still be there, but it's not going to be as intense. But I would say in the beginning, and even maybe more or less during the relationship, it might be a bit draining for the securely attached person as well.
Definitely. And I think ultimately, we only have power and control over our own actions.
Exactly.
And the person who is securely attached in a relationship with someone who is insecurely attached, it's really up to them to be able to recognize when their own boundaries are being violated and to try and reestablish them.
Mm-hmm.
Hopefully, they'll be able to do so in a way that is loving and gentle and not super triggering, but they are part of that dynamic as well and need to also take some responsibility in addition to the insecurely attached people recognizing that this is not easy.
Yeah.
It's not easy for you, and it's also not easy for your partner. And even if they make you feel more comfortable, it is still requiring a lot of conscious effort.
A lot of empathy. And sometimes just practicing that empathy in and out can be quite draining as well, especially when it becomes more conscious, more not like automatic anymore, like not just unconsciously being empathetic. Sometimes you need to be able to practice that conscious effort of empathy with the partner, but that in itself can be quite emotionally draining. So I'm glad that you even mentioned the part of even the securely attached having that healthy boundary placed for them and having their values and their beliefs set in place, knowing that I'm going to walk with you on this journey, but this is where maybe I draw the line. That can also help them protect themselves and not put themselves in a situation where you're also being dragged down by the other partner as well.
Yeah. As you were saying that, I started thinking about being a therapist because having empathy and compassion is a really important part of what we do. And even if it's something that we enjoy doing, have been trained to do, as humans, at the end of the day, sometimes it can be intense. And for us, there is also that professional obligation of tuning into, am I giving too much? Is it too much for me right now? Do I need to scale back? Do I need to start my own therapeutic journey? Do I need to stop taking clients? Should I stop with some of these sorts of cases because this is becoming a little bit too much, and maybe focus on some of these? And so it is important to be aware and to advocate for ourselves in those situations when we are the caregiver, whether it's therapeutically, professionally, or interpersonally, because ultimately we will suffer as the caregiver, and so will the other person, and so will the relationship.
Exactly. You'll reach complete burnout, and you're not going to be able to give nor receive at times as well from the other person.
Okay, so we talked about some things that we can do to heal from these insecure attachments. Therapy, obviously, is something that can really help. There are so many different therapeutic modalities, and I know you use and integrate several of them. What are some of the key modalities that are helpful in navigating and healing from insecure attachment styles?
So there are multiple therapy modalities, and that saying of like, all roads lead to Rome. Multiple therapy modalities are going to lead to that healing of the insecure attachment. They just take different routes. So for instance, CBT can be super helpful as well. In terms of CBT, the way they would look at attachment is much more towards the core beliefs, as you mentioned, that I am unworthy, I am not good enough. So taking those core beliefs, working through them, and then looking at the negative thought pattern that comes up and trying to reframe it, trying to challenge it. And that's where the healing kind of also starts, because you're becoming quite aware of the triggers, and at the same time, you're working proactively to challenge them, to reframe them. So that's CBT. The other therapy modality that I tend to use much more in my practice would be much more EFIT or EFT, emotion focused therapy. And that's because the main core, let's say, of this therapy modality is attachment. So we go through the attachment map with the client. We go through the childhood. We see how their experiences have been in terms of attachment. We see how they were regulating themselves growing up in terms of their emotions. And so through that lens, we work through to see what is getting mirrored right now in the here and now, what is getting mirrored. So it's much more a process-oriented therapy, more experiential, more explorative in that sense. And through those different instances, we will also be working through like emotions, because we look at emotions to be kind of, the gateway to the soul in a way. So they tend to give us such important information. When you're able to identify your emotion, you take quite a lot from that overwhelming feeling, because when we're overwhelmed, it's a mesh of emotion just happening. So to be able to just break them down, we will actively process those emotions, but at the same time regulate those emotions. So that's with EFT. The other therapy modality that comes to mind would be, for example, like ACT with acceptance and commitment therapy. It's a combination of that kind of like CBT-oriented thought process in terms of like negative thought pattern that are getting reframed or challenged, but also the other aspect of ACT would be mindfulness. So a lot of emphasis on being mindful of not only your thoughts again or your emotions or your behavior, but working on grounding techniques, because you do need that to be able to emotionally regulate. You need some grounding techniques as well. And the other aspect of ACT that I really, really appreciate, and I think it would be very helpful in cases like this as well, would be self-compassion.
Yes.
And I know that that's something that's quite, let's say, spoken about right now in the media as well, in social media. But I do want to emphasize that self-compassion can be so therapeutic and can be so powerful, because we are our worst enemy. So many clients come in, and one of the main things you always see in them is the self-critic. The self-critic's voice is quite loud and quite debilitating. And that is the self-critic that will get activated in each of these attachment styles as well. So working through that compassion, being compassionate to yourself, can take you such a long way to even go through that journey of healing. So that's also part of ACT. And yeah, do you have any other like modalities that you would want to also?
No, I think that those three are definitely really helpful. And if someone is looking to heal on an individual level, seeking a therapist that uses 1, 2, or 3 of those would be a great place to start. But while you were speaking, I was thinking of something, and that is I've had so many people reach out because they want couples therapy. They recognize this pursuer-withdrawer dynamic, for example, or they notice that conflict is becoming more heated, or they're more disengaged. A number of things can bring them to recognize that they need therapy. One person really wants to do it, and the other person refuses. And so what I wanted to ask you is, do you feel and do you see that people can work on improving their relationship in individual therapy? Because there is this expectation that it does take 2 to tango, and couples therapy is effective, but it can't be effective if someone doesn't want to come, or if they come, but they don't really want to be there. So for people out there that are watching us today that know that they've got this going on, that wish their partner would engage in couples and won't, can these therapeutic modalities and therapy more broadly help them in their relationship?
I would say it can definitely help, because at the same time, the way you're even kind of describing the situation, it's when the other partner is not willing to come in. Yes. And so we wouldn't want to let that kind of like just keep festering, and you're just sitting there. You're going to have to deal with it day in, day out. So working on yourself and working on those triggers and working on being kind of grounded, because you are in an environment that is constantly triggering you. And so seeking individual therapy from that aspect of like, yeah, even though my partner doesn't want therapy, I can seek therapy from my own, because it's part of self-care. It's part of your own growth as well. And it's part of your own, in a way, you're kind of elevating whatever symptoms are coming up that are quite intense for you. So I would say definitely it can help. I would also say it can only help so much in a relationship where the other person, you will reach a point where the other person needs to be in the room. The other person needs to also be proactive in this process. But in the beginning, definitely, I would say it can help.
I think so. And I think that the self-care piece and the skills development piece is really important. And also there's a sense of empowerment, because if you feel that you really want to take steps to improve the relationship, your partner's not meeting you there for whatever reason, that can bring a sense of stuckness, right? And being able to say, you know what, I'm going to do it anyway. I'm going to look after myself can help break that. Often what I tell people that want to engage their partners who are a bit reluctant is that they think it's going to be a case of, you know, the therapist and the partner ganging up on them, which it's not, just for the record. And the other thing is they think it's going to be some kind of a lifelong commitment. And what I found has been helpful is when the partner, after some time of doing their own work, approaches their partner again and says, listen, I've been doing my own thing. It's been really helpful for me. I really need you to be there with me. And I know you don't want to. I'm just asking you to try. Try 3 times, try 5 times. And if you still think it's terrible, if you hate the therapist, if you don't want to do it, we'll stop. And more often than not, once they get in the room, they stay. And often that person will have a positive experience and think, why didn't I come soon?
It's not that bad.
Yeah, it's not that bad because it's a different context and it's a guided way to kind of reflect and build on all of those skills.
It's a much more contained space. It's a much more safe space. It's not the same as being at home and having that conflict just arise. So as you said, the moment maybe they walk in, they see the dynamic play out, they feel a bit safer. They feel like I'm not going to be attacked in any way, as you were saying.
And there's an opportunity for us in a way to model for them what that emotional attunement can look like.
Exactly.
So, thank you so much for all of your insights about insecure attachment, secure attachment, where it comes from, how it shows up, how it impacts us individually, our relationships, and how to heal from it. As we said at the beginning, you are with us at Thrive. You're seeing clients 18 and above, relationships, anxiety, depression, a whole host of other things, using different modalities, including the 3 that you mentioned. And you do therapy in English and Arabic.
Yes.
Correct? Yes. Anything else you'd like to add before we sign off for the day?
Nothing really. Thank you so much for having me. And I really hope whoever's listening to us learned something new, gained a few insights into their own workings. And never, don't hesitate to seek out therapy. It can really, really, really help quite a lot build that insight and that awareness within.
Yes, absolutely. Thank you so much for your time and your insights.
Thank you so much.